Good afternoon, everyone. I'm Dr.Parinaaz Parhar. I am the clinical head at Oasis Fertility Secunderabad branch, and I would like to welcome you to this Facebook Live session regarding PCOS and infertility. Now, PCOS, also known as Polycystic Ovarian Syndrome, this is a very common diagnosis. Almost about 5 to 10% of our gynec patients will be suffering from this condition. And it is a condition which is not only limited to patients suffering from infertility, but it has a lot of other far-reaching consequences. However, the talk today is going to be limited to the consequences of PCOS resulting in infertility, and that's what we are going to be focusing on today. Now, PCOS, as you can make out from the name, Polycystic Ovarian Syndrome. It's mainly an ultrasound diagnosis where on ultrasound in these ladies, in each ovary, you have a number of small follicles, a number of small cysts which are seen. Now, normally in a lady, I would see on ultrasound about 10 to 12 follicles or small cysts. But in patients with PCOS, you can see as many as about 20 or more cysts per follicle. This is what the ovarian picture looks like, and that is why the name has been given to this condition. But it's not just limited to its appearance in the ovaries. There are a lot of metabolic and physiological effects, changes which happen because of this particular appearance of the ovaries. And that results in all the metabolic syndromes and conditions associated with this particular condition. Patients with PCOS almost make up about 5 to 10% of the gynec patients who visit us. Now, the most common condition that these patients would present to us would be irregular periods. When anyone talks about PCOS, you have a very typical picture which comes to your mind. That is of a lady who is slightly overweight, a lot of hair on the face, and someone who has got acne, pimples all over the face. Patients usually think that if they have irregular periods and if they are overweight, they make a self-diagnosis of PCOS. That may not always be true. We diagnose a patient with polycystic ovaries if they have 2 out of the following 3 features. If a patient is complaining of irregular cycles, now this is a very common presentation. If you have just started your periods, if your periods have just started, the first year it's very common to find girls with irregular periods. So just because you have irregular periods in the first year post start of menstruation doesn't mean that you have this particular condition. It's usually after the first year, if you still continue to have irregular periods, where they come maybe once in 5 weeks, or you are suffering, you're getting less than 8 cycles per year, or suppose if you're not having your periods for almost up to 3 months at a stretch, or in general, if your periods are coming very infrequently, that is at less than 3 weeks or more than 5 weeks apart, it is then that we say that yes, you are suffering from a case of irregular cycles and you need to be investigated. Most of the patients in such condition can have polycystic ovaries as the main reason for this irregular cycle. Besides this, patients with PCOS might also present with features related to high male hormone levels. So this is known as something called as a hyperandrogenism. The male hormone level, as expected, is at a very lower range in females, but in patients with PCOS, because of the general physiology, it is at a higher level. As a result, they present with features like pimples, oily skin, they have excessive hair loss, they might present with excessive hair over their face, which needs frequent removal. So these are all features which they might present with. The third common presentation which is there is an ultrasound finding, which I already described, which led to this name of polycystic ovaries for the condition in the first place. So if on ultrasound, if your ovaries are bulky, if the volume of the ovaries is more than 10 ml, and if you have a number of small follicles, then it is called as a polycystic ovarian morphology. So if anyone has any 2 of these 3 features, that is, they have either irregular periods, or they have features of excess male hormone, or they have an ultrasound diagnosis of multiple follicles in their ovaries associated with very bulky ovaries. So any 2 or more out of these 3 features, then you will be called as someone who is suffering from polycystic ovarian syndrome. Now, why are we concerned with this condition? Why are we so bothered by it? The main reason is that the effects of this condition are not just limited to these three factors. It has a lot of far-reaching effects, consequences. The main etiology, the main reason why all this is happening is something more deep-based in your system. It's mainly because of a hormonal imbalance. And the two main hormones which are resulting in a vicious cycle which increases the severity of this condition is the male hormone androgen and the insulin resistance. Now, insulin is a hormone which is present in the body. It increases the utilization of glucose or sugar by your body cells. Insulin helps in your body tissues utilize glucose. In patients with PCOS, there is very high level of insulin in the body. So there's no deficiency of insulin, but it's not acting efficiently. And because of this, because of the resistance to it, the body tissues are not able to use the glucose that well. As a result, patients with PCOS are very prone to developing conditions like diabetes mellitus, and even in pregnancy, they are very prone to developing gestational diabetes mellitus. Another thing is that these patients, the insulin resistance which is observed in these patients it tends to worsen with the weight gain. Now, we normally tend to picturize a patient with PCOS as someone who is very hefty, but that is not true. There are basically two types of PCOS. You can be an obese PCOS, the overweight type, or you can even be a lean PCOS. Now, the lean PCOS also can suffer from insulin resistance. Of course, it will be more frequently found in patients who are on the heavier side, but even the lean patients, it's very important that they keep their weight in check. Because the moment you start losing weight, the tissue in your body becomes more sensitive to the insulin. And the main reason, the main condition which is leading to the worsening of all the mechanisms in your body, that is brought under control by a simple action of weight loss. So, in patients with PCOS, one of the main things responsible for the worsening of the condition is insulin resistance, and you can easily bring it under control by weight loss. The second thing which is there is the hyperandrogenism, which is the increase in the male hormone levels. And that is also to a great extent associated with the amount of insulin resistance which you have. Now, how do you bring this under control? Like I already explained, the main thing which will help you achieve insulin sensitization is by weight loss. Lifestyle modification is a very important factor. It's very important in trying to control the effects of PCOS on your health. Because of the different effects of PCOS which are seen, patients with PCOS are more prone to metabolic syndrome, which is associated with increase in your lipid levels, hypercholesterolemia, like I already told you, even diabetes mellitus, raised blood pressure. They tend to be obese. Almost 50% of the patients with PCOS will be obese. Besides this, they are also prone to development of endometrial cancer in the long run because their periods are very infrequent. Now, the most common presentation, like I've already told you, is irregular periods. Irregular periods is a depiction of the fact that your egg is not getting released every month. We have already stressed on the fact that in patients with PCOS, in the ovaries, you have a lot of small cysts. That is why the name polycystic. Now, these cysts are basically follicles which harbor your eggs. So, if you have so many eggs, great, you should be really fertile. What is the problem? But no, that's not the case. Even though you have a number of eggs in patients with PCOS, these are not of much use because they are not released every month. Now, because the focus of today's discussion is related to the impact of PCOS on fertility, we will only be touching on this topic. So what happens in a patient with PCOS is, because the most common presentation is irregular periods, irregular periods happen because you are not ovulating on time. Normally, every lady, most of the ladies, the ones who have regular periods, will be having one follicle growing in a month, and this follicle then goes on to ovulate. And that is the reason when you have intercourse around that time of the month, you can get pregnant. Now, what happens with patients with PCOS is because of the hormonal imbalance, this simple cycle is not happening. They are raised male hormones, their increased insulin resistance, all these conditions, all these things in their body, their hormonal imbalance in general, it does not allow a follicle to grow. So even though I have a lot of follicles in the ovaries, they are not responding to all the hormones which are being secreted, as a result of which there is no male follicle growing. There is no ovulation happening. Since there is no ovulation happening, these patients find it very difficult to conceive without help. Because the ovulation is not happening, they do not get their periods on time. That is why the most common clinical manifestation is irregular periods. As a result, what happens is their lining, their endometrial lining, which is the inner lining of their uterus, keeps on growing. It keeps on growing until it grows to an extent where it cannot be supported anymore by the body, and the patient ends up having heavy bleeding after, say, about 2-3 months, even though she did not ovulate. So these patients usually present with irregular cycles, say once in about 3-4 months. And after that, when they bleed heavily. In fact, some of them even end up with having anemia or very low hemoglobin because of the heavy blood loss which happens. That's also the main reason, because the extent to which their endometrium tends to grow every cycle, they are at high risk for endometrial cancer. So the main reason for infertility in these patients is because of their anovulation, because unlike a regular fertile lady, patients with PCOS, in spite of having the number of eggs, are not ovulating. Now, so as a fertility specialist, simple logic tells you that my treatment is going to be aimed at making you ovulate to help you conceive. So when a patient comes to me with this particular condition, the first thing that we try to emphasize on is the importance of lifestyle changes. It's very important to understand that the heavier you are, the more severe is your condition going to be. In fact, many times patients would have noticed themselves that the moment they end up gaining some weight, their periods become even more irregular. Now, when a patient is at the same time, you have these stories, patients had PCOS, they have irregular cycles, but they conceived on their own naturally. Yes, it can happen, because it does not necessarily mean that the patient is not ovulating at all. At times, you might have 1 or 2 stray ovulations, and some of the lucky few might conceive, but most of them will find it very difficult to conceive. So the first step which you have to do is try to lose weight. I know it's easier said than done. How do you manage to do this? First is by diet control, and the second is by exercise. I cannot emphasize enough the need to make a lifestyle modification in PCOS this is one condition where if you decide, if the patient shows good willpower to try and bring their weight down, the treatment results are miraculous. So what we are aiming for is, I'm not expecting a patient who's about 90 kgs to become 50 kgs. Even if you bring about a weight loss of about, say, 5 to 10%, that should be good enough. Patients have been shown to develop spontaneous ovulation with as less a weight loss of about 5 to 10%, and that's a very encouraging figure. So how do you achieve this? Now, when I'm talking about a diet for a patient with PCOS, what I'm really looking at is a low carbohydrate diet. There's also this concept of glycemic index, which basically tells us about that if I have a given food, what is the spike in my glucose level in my blood after taking that? So patients with PCOS should basically avoid foods which have a high glycemic index and go for foods which have a low glycemic index, which means that these are the foods which don't lead to a sudden spike in your glucose level. They provide you constant low levels of energy. So basically, this translates into avoiding foods which are processed, what we normally call as junk food. If you are a PCOS, if you want your condition to be under control, if you really are looking forward to a healthy life and no difficulty in getting pregnant, please concentrate on weight loss. Firstly, control your diet. Avoid all processed food, no sweets. Sugar is your biggest enemy. Processed food is supposed to be avoided. Junk food is to be avoided. Try to have food which is high in fiber. Try to have fruits and vegetables which are of different colors, because they are usually associated with high antioxidant levels, which is good for your general health. Nuts which are high in omega-3 fatty acids, also very good for these patients. And the most important thing is cut down on your carbohydrates. Look for a carbohydrate deficit in your calories of about 500 to 750 kilocalories. so as to help you achieve a weight loss of about at least 5 to 10%. For many patients, just diet will not help. It's always better to inculcate some sort of exercise in your regime, because exercise in any form is going to help in improving your insulin sensitivity. Another way which exercise tends to help you is because exercise, now it's a very commonly neglected part of PCOS, but because of the general appearance that this condition is associated with, patients with PCOS suffer from very low self-confidence, and they are often associated with depression, anxiety. So exercise is not only helping you control the condition, it's also helping you release endorphins and feel good about yourself. It helps improve your body image. So it's just a win-win situation. Now, what kind of exercise is good for patients with PCOS is you can indulge in aerobics. You can do some moderate intensity workouts, jogging, swimming, running, walking. Just move yourself. Try to walk at least 10,000 steps per day. And they usually say that if you manage to exercise about 30 minutes per day every week, that should help you achieve your target of 5 to 10% weight loss. Exercise is not only going to help you lose your weight, it is going to increase your basal metabolic rate. It is going to increase the sensitivity of your tissues to insulin. And since that is the main mechanism which is responsible for the ill effects of polycystic ovaries, it cuts the disease at the root. So it's very important to exercise in this condition. Now, so if a patient is presenting to me with infertility where they have not been able to conceive for more than a year in spite of regular intercourse, and she is a patient with PCOS, so if this patient is obese, I will advise her to first try and lose weight before I move on to the other medical forms of treatment. If she is a patient who is already thin, but if she has acne all over her face and hyperandrogenism and all other features, other signs of hyperandrogenism, I would still insist, I would still re-emphasize the importance of keeping her weight in check. You might be lean, but it's important that you maintain that weight. Please don't gain weight, because there will be pressure that, you're too lean, try to put on some weight. It's very important that you exercise, eat healthy, and don't gain too much of weight. That's one thing. So that's about the lifestyle modifications that are very helpful in patients with PCOS. If quite a few number of patients would conceive with this simple intervention. For the others, so we usually give patients, if they are young patients, we give them about 6 months or so to try and lose weight and then get back to us. Some of them would, and we ask them to maintain a diary where they are noting down their menstrual diary to see how, when their periods are coming. So most of them will notice a change in the frequency of their periods, and it moves towards a regularization once they start achieving a weight loss. Now, if that does not happen, the patient gets back to us. So if you're in the normal range, if you have achieved weight loss, or at least if you've tried and still not managed to conceive, then in that case, the next step would be to try to give you medicines to make you ovulate. So like I told you, the main problem here is that the egg is not ovulating. So what we do is we give you ovulation induction drugs, which are usually tablets, and these tablets make a follicle grow. And we call you for serial scans. We call you for scans, say once in 2-3 days, to see how the follicle is growing. And when it's ready, we give you an injection for ovulation. Patients where the husband's sperm parameters, semen parameters are good, are used to have timed intercourse around the time when the lady is about to ovulate. Whereas for others, if the male partner also has poor semen parameters, then in those cases, we can do an IUI for you, where we ask the husband to give a semen sample, and that sample is processed in the laboratory and it is inseminated into the uterus. Now, the problem with patients with PCOS is that you usually have two extremes of response to these ovulation induction drugs. Either they have a hyper response where, I give them a very low dose and they just get too many follicles ready. The other spectrum of the response is where I am giving them medicines, but there is absolutely no response. So these are the first category. If I have experienced once that this patient is very sensitive, they have a tendency for hyperstimulation. In this particular group of patients, the next time probably we'll give them a very low dose, at half the dose of what we normally give to the patient. But if you are in the latter category where I have given you tablets and still there has been no response, the other option for me is to start a second cycle with a slightly higher dose of the same tablets, or add on injections to make your follicles grow. Now, the thing with injections is that they're slightly more expensive, obviously slightly painful, and I need to regularly monitor you, do regular scans to decide what dosage until when these injections are to be given. Another treatment option which is available for patients who are not responding to simple oral tablets is laparoscopic ovarian drilling. Now, it's very important to understand that laparoscopic ovarian drilling is not for everyone. Just because you have PCOS, you have irregular periods, doesn't mean you're going to benefit from this condition. Patients who stand to benefit from laparoscopic ovarian drilling are usually the thinner ones, the patients, the lean category of PCOS, and those who have very bulky ovaries where the volume is more than 10 cc. And the third thing is those who have a lot of androgenic features, male hormone is in high levels, and the LH values in the body are very high. If you are a patient who is hefty and if you're going for a laparoscopic ovarian drilling, it's not really going to help you much. In fact, sometimes drilling does more harm if the patient is not selected well. So it's very important that your doctors, you are actually identified as someone, correctly identified as someone who stands to benefit from this condition. We normally go for laparoscopic ovarian drilling for those patients who are lean, who have hyperandrogenic features, high male hormone levels, who have very bulky ovaries, and for those whom we want to rule out any other causes of infertility, like any blocked tubes, or if we feel they have some features of endometriosis. Also, if you're someone who's living in a remote part of the country where you will not be able to come for regular injections and follow-ups with your doctors, laparoscopic ovarian drilling is helpful in these patients because we can try to evaluate them at the time of the surgery, try to make their ovaries more sensitive to our treatment, and then post-surgery, give the patients a break of about 3 to 4 months to try to see how helpful it has been. So it's helpful for those who cannot come for regular follow-ups, which are essential with injections. Now, this was about the ovulation induction. Normally, most of the patients will usually respond to, if not just tablets, to a combination of tablets and injections and would ovulate. When I'm doing a simple cycle of ovulation induction, the chances of success per cycle would be somewhere about 10 to 15%. And depending on your age and other associated infertility factors, if I combine it with an IUI, you can approximately expect the chance of success to improve by another 3 to 5%. Now, normally, if a patient has had 6 cycles of ovulation induction tablets, where we have seen that she has ovulated, but in spite of this, if she has failed to get pregnant, it means that this is something beyond which is going to be corrected by a simple treatment. So this kind of patient, if I have, the next option for them can be to combine the ovulation induction for IUI. IUI, when we do, the maximum chance of success is in the first 3 cycles. If in spite of that, the patient is not conceiving, then it would be helpful to try, then it's important that we counsel the patient to the next higher level of treatment, which would be IVF. Now, again in IVF, why IVF might help in these patients if the simpler treatment is not? Because we know that PCOS is blessed with a huge number of eggs, but just because you have the number does not translate into good quality. Very often these patients will have poor quality of eggs. So what IVF tends to do is that we're trying to get about as many eggs out as possible. We stimulate the patients and we make a good number of eggs grow rather than just 1 or 2, which we aim for in an IUI cycle. And once these eggs are ready, we retrieve them through the vagina using a needle while the patient is under anesthesia, combine the eggs with the sperm in the laboratory, form the embryos, and these embryos are later transferred into the patient's uterus. Now, a common problem which is seen in patients with PCOS who are going for IVF is that, again, they will either respond to a very low dose of injection or they will need a very high dose of injection. So it's either very less or very high. So that's why the doctor will usually start with a low dose and slowly taper it to step it up to a higher dose if required. So we need frequent monitoring. But still, okay, so IVF tends to help these patients because it is very programmed. If suppose your egg quality was not good in your simple cycle of ovulation induction, because in IVF I have more eggs which are out, the probability of at least some of them being good and giving rise to embryos increases. The second thing is in IVF, especially in ICSI, we are directly putting the sperm into the egg. And so we are facilitating the whole merger of the sperm with the egg. So if someone has some sort of tubal factor, which is responsible for the infertility, that is also taken care of in IVF. So because it is so controlled, that is why the chance of success in IVF increases to almost 40 to 50%. Besides, in patients with PCOS, the chance is even better because the cumulative live birth rate is very high in these patients. Now, in IVF, what we do is first we form the embryos and then we transfer the embryos in the uterus. Normally, in patients with PCOS, if the egg quality is decent, we would expect a good number of embryos. If I'm doing a day 5 transfer, I'm not transferring more than 1 or 2 embryos in one cycle. The more number of embryos I have for a patient, the more number of embryo transfers I can attempt for the patient. So, you might just need one cycle of stimulation, but you will have enough embryos most of the time to allow about 3 to 4 embryo transfers. So, suppose if you get pregnant the first time and you're someone who has resistant PCOS, no matter what dosage of injections you take, you don't respond normally, you don't get your periods without taking any tablets for getting your periods. If you fall in that category, you would find it difficult again to conceive again. So say about 3 years down the line, if you want a second child, and I have your embryos frozen from your first stimulation, you can always use the embryos which were frozen 3 years back to give you a pregnancy later. So the number of pregnancies which can result from one cycle of stimulation in patients with PCOS is relatively high. Now, this is one of the boons of PCOS. Now, there might be one particular, like I told you, there can be a hyper response because of the injections which we give. Sometimes, even if I'm giving the patient a low dose of injections, they might get a number of follicles which might be ready. Now, each follicle secretes a certain amount of hormone. So the patient with PCOS specifically is at higher risk of developing a condition called as Ovarian Hyperstimulation Syndrome. And this condition, what happens is, because of the increased amount of estrogen which is secreted by the follicles, by your ovaries, there is fluid collection outside your blood vessels in your body. So it happens in your abdomen, in your peritoneum, it can happen in your lungs. And it is a condition which all of us as infertility specialists want to avoid. It's a dreaded complication. Now, this was very common in the past because of the medicines which were used. But because of the medicines which we are using now, you can safely say that most of the clinics are OHS's free clinics. So, ovarian hyperstimulation in its severe form is rarely ever seen now. Treatment for patients with PCOS is very safe. The medicines which we give now are very safe, and hyperstimulation in the form which I have just described is no more seen. Because we give you medicines in order to bring your hormone levels down. The biggest safeguard against developing this particular complication post-stimulation in patients with PCOS is to freeze the embryos. So very often you'll find a doctor discussing with you that because you're a patient with polycystic ovaries, they cannot do fresh transfer for you. They would prefer to do a frozen embryo transfer. And the main reason for that is because in patients with PCOS, the hormone levels are very high, because of which they have a tendency for developing hyperstimulation. And because of that, again, they can develop difficulty in breathing, they can develop bloating of the abdomen, and they can even develop thrombosis. So this is a complication which everyone tries to avoid and successfully avoids because of the recent drug protocols and medicines which are available. Now, there are also patients who, in spite of giving a very high dosage of injections in IVF, might not really respond to treatment. This is an extremely resistant case of PCOS. Fortunately, they form a very small percentage of our patients, but yes, there are some patients who don't respond to even very high dose, or their egg quality is extremely poor in spite of going for an IVF. So how do we help these patients? So we at Oasis are very commonly use a commonly use a technique called as in vitro maturation. And what happens here is, now this particular, what happens in IVF is that we take out the mature eggs once they have become big in response to all our injections. Once they have become 17 mm or more, that's the time when we take it out and combine with the sperm and form the embryos. In IVM, what we do is, we don't wait for the eggs to become that big. Once they're about 10 to 12 mm, we retrieve them right then, and we make the eggs mature in the laboratory. So this particular technique is very helpful for two categories of patients as far as PCOS is concerned. One, who have a tendency for hyperstimulation, where even if I give them a low dose injections, they produce a number of eggs. And the second category is where I'm getting a very poor response to my stimulation, or I'm getting very poor quality eggs. So these two categories of patients have been shown to really benefit from this procedure called IBM. And there are just a handful of clinics all over the world who practice this, and we are one of them. So this is a very cheap and safe alternative to regular IVF in patients with PCOS. So this is mainly about the treatment for PCOS. Uh, the infertility treatment for PCOS. We are now open to any questions if you would like to ask regarding this particular topic. If you have any questions regarding PCOS and infertility, you can post your questions in the chat and I'll try to answer them live. If you have some questions, if you're watching the recorded version, you can post them again in the chat and we'll get back to you with the answers later. Let me just check if there's anything which has come. Okay, so there's a question about what should I not eat with PCOS. I think we have already answered this. Avoid all processed food, avoid food which has high glycemic index. There's a lot of talk about dairy foods also, especially processed cheese is not good for you. Curd with sugar is not good for you. And have high fiber diet, and try to have nuts which have a lot of omega-3 fatty acids in your diet. Avoid sweets altogether, no processed food at all. Okay. So there's a question about how do I get rid of PCOS completely? See, PCOS is a condition, you cannot get rid of it completely. You can try to keep it under control. So it's more about taming the condition, and how you can try to keep it under control is most importantly is by lifestyle modification, keeping your weight in check. Patients with PCOS, unfortunately, because of all the changes, hormonal imbalances which it causes, they are very prone to a lot of metabolic syndromes and conditions like diabetes, hypertension, and endometrial cancer. So it's very important that these patients are regularly checked for these particular conditions. So you can't really get rid of it, but you can keep it in check. You can keep it in control. Diet and exercise is very important. Regularly check for your sugars and your blood pressure and your cholesterol. And and another thing is that try to see if your periods are coming regularly. We are targeting for at least 8 cycles of menses per year. If you're not getting them spontaneously, take a progesterone pill under your gynec's guidance to try to get your periods, because not getting your periods at least 8 times per year means that you are allowing your endometrium to grow that much every time before your periods come. And that means it is more prone to endometrial cancer. So you cannot cure PCOS completely, but you can keep it in check. And you need to be aware of the side effects of it, of the conditions that it can lead to, so that you can take actions to diagnose them early. If your weight is in check, you will be able to protect yourself against most of these conditions. If your sugars are under control, because your sugars are a reflection of the degree of insulin resistance you have, again, you will be able to keep this condition in check to quite an extent. Then there's a question about which drink is good for PCOS. Again, avoid sweetened drinks which have high sugar levels. And a lot of patients ask about fresh juice, but I would rather say that they go for fruits. Fresh fruits are more helpful because they even have high fiber. And most of these canned juices and everything have a lot of artificial sweets and everything, sugar which is added to it. So no, go for fresh fruits, avoid juices, and avoid sweetened this, what do you call it, your cold drinks and soft drinks and processed food in general. How can I get pregnant fast with PCOS? You can get pregnant fast with PCOS if you are overweight, by keeping your weight in check and by consulting your reproductive medicine specialist to help you to try and diagnose what is wrong. Again, I would like to stress here is that many times what happens is, just because someone looks like PCOS, they are diagnosed with PCOS and they are wrongly given that kind of treatment. So just because a patient is overweight and they're getting irregular periods, I have seen patients like this where they have been told, or they assume to themselves that, I must be suffering from PCOS because this is very publicized disease in the media and everything. So please don't go by that image. Consult your gynecologist, because at times your irregular periods can be because of thyroid dysfunction. They can be because of high prolactin levels. Irregular periods can also be because of someone who is having a very low ovarian reserve and someone who is heading towards premature menopause. So the treatment for the two conditions, PCOS and someone who is heading towards premature menopause, is very different, but the presentation may be the same as irregular periods. So if you're suffering from any of the features of PCOS, it's very important that you consult your gynecologist and confirm whether you really have the condition before you start self-treating yourself. Why is it so hard to lose weight with PCOS? That's an interesting question. It's so hard to lose weight, again, because of the insulin. I would say that yes, they have a tendency. It is associated, the condition is associated with it. The hormonal imbalance which is associated with it, to an extent, makes it a bit difficult, but it is not impossible. It's not a condition which is going to disappear. So you need to be committed to your efforts to lose weight. It is not impossible. Yes, might be slightly difficult, but for anyone, weight loss is difficult. It is not specifically for PCOS patients that weight loss is difficult. Anyone is going to find it difficult to lose weight. So I would not say that it's very difficult specifically in PCOS to lose weight. In fact, in PCOS patients, the rewards are very high if you lose weight. So let's look at it that way. It's very rewarding to lose weight in a patient with PCOS. Someone has asked, how can I get pregnant naturally with PCOS? Like I mentioned earlier in my talk, a lot of patients, when they lose weight, they start ovulating themselves spontaneously and they might just naturally become pregnant. So you can try this. You try to give yourself, if you're young, you can give yourself some time where you commit yourself to a diet plan and exercise plan to try to lose weight. If you're noticing a weight loss, and you maintain a menstrual diary to see how your periods have responded to this weight change. And accordingly, because patients with PCOS don't have regular cycles, so it's very difficult to say that, okay, this is your fertile window, this is the time when you should try to keep relation. So because that is not helpful for them, what you can try to do is try to have intercourse at least about 3 times a week. That should be good enough. Once your periods are over, try to have intercourse, at least 3 times a week, and that should be helpful for you. So you can try doing that for about 3 to 6 months if you're a young person with PCOS who is losing weight, and see if that helps you. If it's not helping you, you can consult your doctor for further help. What happens, now there's another question about what happens if PCOS is left untreated. If PCOS is left untreated, these patients will have irregular cycles. Like I stressed earlier, the lining keeps on growing unchecked. They get their periods very irregularly. And because of that, because the endometrium tends to grow very thick, these patients are about almost 2 to 6 times more prone to developing uterine cancer. The second thing with patients with PCOS is that they're very prone for developing diabetes mellitus, because if you have unchecked PCOS, you tend to have impaired insulin resistance. Almost 35% of the patients, and if you're obese, if you're overweight, almost 70% of the patients have impaired glucose tolerance, and 10% of these will develop diabetes. And this is a very young group to really be suffering from diabetes at such a young age. Even if you get pregnant, patients with PCOS are very prone to developing gestational diabetes mellitus. Again, if it's not treated, infertility, like the topic of today's talk, you are more prone to having difficulty in conceiving. So these are the things which are more prone to happen to you if you don't take care of if your PCOS is left untreated. There are one thing which I forgot to mention earlier on is the use of medications like insulin sensitizers like metformin, and there are a lot of other medicines which are available in the market, and all of them function on the basic concept of trying to make your body, your tissues more sensitive to the insulin which is there. A lot of patients, when we prescribe them the medicines, would be like, oh, I checked it on Google and this is a medicine which is given to patients with diabetes. But what you don't understand is that the mechanism of PCOS is similar to what is happening in a diabetic patient type 2. So the good thing about this medicine, which is metformin, is that it is not going to bring your glucose levels very low. So don't be scared of a hypoglycemic attack or something with it. That does not happen. It's basically going to make you more insulin sensitive and help in improving your response to the treatment. A tip here would be that normally your doctor would tell you that not to start with the recommended dose of taking about 3 tablets of 500 milligram straight away per day. When the doctor will usually step up your dose in order to improve your tolerance to the medication. So we would normally tell a patient to take it once a day for a week and then increase it to twice a day and then thrice a day. So that's about this. What can happen if PCOS is left untreated? Can PCOS go away after pregnancy? Not really. When you get pregnant, you are taking care of one of the effects of PCOS. PCOS is not just going to disappear post-pregnancy. It's going to be there. Probably you will not be bothered as much about it because you've already had your child. But patients with PCOS still need to take care of their weight because they're still prone for all the ill effects of PCOS even after they are done with their pregnancy. Can PCOS go away with weight loss? Weight loss can help keep PCOS in check as long as your weight is under control. The moment you start gaining weight, again, that disease is going to flare up. So PCOS can be kept at bay with weight loss, but it's not just going to disappear and never come again. It's just going to be there silent. So if you gain weight, it's going to start manifesting again. I think I've covered most of the questions. That's all. Someone has asked about can removing ovaries cure PCOS? That's a very radical cure, but yeah, it's also going to end you up with menopause, which has its own set of side effects. So I don't think that's a treatment which you're really looking at. I think we're done with our questions. Thank you so much. And if you still have any questions which are unanswered, you can post them in the chat box and we'll get back to you later. Thank you.